With so many options, why choose Arizona State University?
For me, the only online option was ASU because of the quality. Their faculty was really involved with their students and care about your personal journey. The dedication to my personal development from my professors, that's been extremely valuable to me.
Earn your degree from the nation's most innovative university. Online. That's a degree better. Explore more than 300 undergraduate, graduate, and certificate programs at asuonline.asu.edu.
Everything from clothing to household items are getting more expensive each day. The world of fast fashion has complicated clothing production by shipping cheap parts around the world to whoever can sew them the cheapest. And now you, the consumer, are paying the price with rising costs. American Giant is about keeping things simple and close to home. They aren't affected by tariffs because their products never leave the U.S. Skip the tariff and snag yourself American-made clothing with American Giant. Get 20% off your first order when you use promo code STAPLE20 at American-Giant.com. That's 20% off when you use code STAPLE20 at American-Giant.com.
Joining me now is Dr. Basima Williams. I want to talk about, well, something we like to talk about here a lot. It's health. I don't know. As I get older, it's a topic I want to talk about more because I want to be healthy. As I, of course, have had the experience to interview a lot of medical doctors related to COVID and the COVID crisis and all this going on. Again, it's a topic that our audience is extremely interested in. And we know that there are many issues that impact people's health. But how many of them are reversible, are preventable? We've got all kinds of them. We've got cardiovascular diseases. We've got the issue of cancer. I was reading a report today, in fact, 10 million people die annually from cancers. 10 million, really? You have, of course, mental health disorders. That seems to be on the rise. Dr. James Thorpe's done a study with the psychiatrist, Dr. Peter Breggin and others on that. All the psychological disorders, and they're tying it back to the shot, the bioweapon. Anxiety, depression. Then you have neurological disorders that seem to be greatly increasing. Autism, dementia, Parkinson's, these kind of things. How much of this is environmental? How much of it is genetics? How much of it is reversible or preventable? The last thing I want to end up with is dementia or Parkinson's or Alzheimer's, that's for sure. I have a friend of mine, he's getting advanced in age, so that kind of comes with the territory, right? He's a pretty wealthy guy, but he really can't do much. He has the ability to pretty much do whatever he wants. He has a private plane, he has all these things he can go do. But if you don't feel good enough, he doesn't get to use a lot of what he has because he doesn't feel well enough. And yet I know other people that are his exact age that are out doing all kinds of activities. All kinds of activities. So at some point, you can't put a price on your health. Because I know guys that have money, they can't hardly get out of their house. And some of this, of course, I think is preventable. My wife, she's very big on me moving, getting up and moving and walking and exercising. She thinks I sit at this news desk too many hours out of the day or at the desk studying and reading, and she's probably right. How much of these things are preventable or reversible? Let's talk about that. What are some of the biggest health crises facing us across the globe and here in America? Dr. Basima Williams joins us. Many of you will know her as Tina's, with Worldview Talk, Tina's sister. Tina, Basima, that's your full name, or do you go by a shorter name?
That's my full name, yes.
That's it. All right.
Yep.
So, what do you make of my opening monologue?
Yeah, first of all, thank you so much, Brandon, for having me here. And I love having platforms that I can stand on as a functional medicine, board certified family practice doctor, that I can actually speak truth into people. There's so much nonsense going around. So I really appreciate this opportunity. And I hope that we have a lot more sessions like this. But what I want
I want to have a lot more sessions like this, but I also want to make sure I understand you're an MD. You're also in medical doctor and functional medicine as well, right?
That's right. That's right. Because I, like you, was in practice going, what the heck? Why are we seeing so many more autoimmune diseases, so many more cancers, so many more heart attacks, and how many of these are preventable? And some of these patients were getting younger and younger and younger. And so I started just randomly reading books for my own health and wellness. I wasn't suffering from anything, but I'm like, what is going on environmentally? I knew it was a multifactorial problem. It wasn't a one thing. It wasn't just the fat-free cookies that we ate in the 80s that caused this epidemic, and the high fructose corn syrup that they started adding to our foods in the mid 70s, which started increasing obesity rates significantly. It wasn't just one thing. It wasn't just the vaccines and the 7 or 8 shots we give, a 2-month-old at one time. Like those are so ridiculous. And by the way, I'm just sharing information. I'm not giving anyone medical advice. Just want to throw that out there. But what I do want to say, one good thing that came about with COVID is what we learned explicitly is that lifestyle matters, because we saw significant decrease in people who had a good lifestyle, normal weight, worked out on a regular basis, slept well, had good control of their stress, etc. We saw that their rates and complications of mortality and morbidity was significant, and hospitalization rates were significantly less compared to those who had a unhealthy lifestyle, including things like being obese and taking certain medications and having high blood pressure and things like this. So what we sort of concluded from a functional medicine perspective is, man, lifestyle matters, not only in long-term prevention of chronic diseases, but also in outcomes of an acute problem.
All right, so let's talk about some of the things we were talking, I guess we're saying the same thing. It's this collection of things, right? But you mentioned the 1970, the oil. What kind of oil did you mention?
It was actually sugar. It was cheaper to use high fructose corn syrup, and the shelf life on the shelf of foods. So they started putting it in everything. They replaced natural sugar, with high fructose corn syrup, which has dramatically different outcomes inside of your body in terms of how your body processes sugar, and it's glucose or fructose. And so what it slowly led to a national epidemic of something called non-alcoholic liver disease, meaning when I was in medical school, the most common cause of liver disease was alcoholism. And all of a sudden now it's fat storage inside of the liver due to high glucose and fructose intake. And high fructose corn syrup is linked to that indirectly. So, and
they knew that did they know in the 70s what it was going to do to people?
I don't think they knew in the 70s what it was going to do to people. And I also don't think that it was that they recognized how much of this stuff people were going to eat. And the truth of the matter is, if you're genetically predisposed to prediabetes, for example, you may metabolize glucose differently. And the problem is when your blood sugars go up, your insulin level goes up. And then your blood sugars bottom out, like when you eat something sugary, all of a sudden an hour or two later, you feel really tired and you have to eat more sugar to keep up with that elevated insulin. And it's a vicious cycle all day long. And so I think that's the effect that the high fructose corn syrup was having, is it was creating this overwhelm of eating more and more, a lot more than what a person needs to sustain their, what they need, period, daily in their macronutrients. Not only that, it also increased the balance of carbohydrates amongst the 3 macronutrients, proteins, fats, and carbs. It significantly increased how much carbs people were eating. We tried to combat the obesity epidemic that we started seeing in the 80s with creating fat-free foods, which of course did not solve the problem. It only added even more fuel to the problem, because it gave people this misidea of, oh, I can eat as much as I want of these fat-free cookies. But what I really want to focus on is some solutions that we have created that has had a huge impact on our patients.
And I'm guessing part of that is gut health, because when I go to your website, I see you have a whole course on gut health.
Yeah, we have a whole course on gut health, the Feel Good Gut Health, because One of the reasons we started with gut health is because 70 to 80% of your immune system is in your gut. So we know that when we really heal and take care of the gut, and by association, then we also focus a lot on nutrition. When we really focus on that, we see a significant improvement in health and wellness in our patients. They're feeling better. Their joint pains are not, the significant decrease in joint pains, eczema, rash goes away, brain fog goes away, all sorts of numbness and tingling, restless leg syndrome. I have patients on so many drugs that we actually systematically, slowly decrease. I've significantly decreased the number of drugs I've written every year. And I've also, I actually stop more medications than I prescribe every year. And I'll tell you something else really quick. This is one of my favorite vitamins. If you don't mind, I want to share it. This is my Magnesium Restore vitamin. And this particular vitamin is the reason why I have not written a prescription for a sleep drug in close to 15 years, with the exception of sometimes I'll need to use it like for 1 or 2 days, depending on, surgery, or if it's a travel issue, then we want to do that. But I really have 0 patients on long-term sleep aids. I don't need them. We teach people how to sleep. We teach people to take care of the root cause of the problem. It's time to turn that sink off that's over flooding rather than mopping up the floor.
Mm-hmm.
We need
go back to that. The vitamin. What is that again?
This is called Magnesium Restore. It's from myvitamin.com. And myvitamin.com is a company that I started because, as you can imagine, if I'm seeing a wife, a mom, she is, after we get her on some really good supplements and good nutrition plan and everything else, almost always, what can my husband take? What can my kids take? And I'm like, well, I'm not their doctor, but maybe if I created a company, so we created myvitamin.com, and these are the med packs that a lot of our patients order, where they will get a pack, morning pack and evening pack. So morning supplements, evening supplements. Obviously, we've put this magnesium in the evening to help with calming down the brain, time to shut off that brain that's going, 24 hours a day, like that. And so we made these med packs primarily because our patients were asking for them. And we took care of our patients. We had given them these professional grade supplements, but they wanted the same for their families, whether it was their teenage kids or their spouses. So we created these. We have foundational packs for men, for women, for teenagers. This is the most popular pack. It happens to be called My Vitamin Calm and Restore. It's especially for people who are doing a lot in their life and feel wired all the time. It's especially nice and calming. Everything in there is natural. There's nothing weird in there, which is why we can offer it on a national show like this, because it's very safe to take. You always want to run it by your doctor, but man, we've got so many tricks up our sleeves as functional medicine doctors that we've helped people. My favorite thing to do is educate and empower, because if we can educate and empower, then we have forever change. We don't have temporary change. This
is fascinating. By the way, I think we have a URL, which is myvitamin.com/worldview. If you use that, we'll get a little credit here and help support the network at the same time you're supporting your health. We love this kind of relationship. So go to myvitamin.com/worldview. Now, I want to go back to that packet. I just asked Melissa to bring into the studio the packet, because when Melissa, check this out now. How long have you and Melissa been working on this? A month, over a month, right?
Yes.
Yeah. And so you shipped her some packets, and first of all, I liked the packaging. I said to Melissa, that's very attractive packaging. I liked the way it was organized. You just rip off your pack, for morning, for night. You had it for men, you had women. I mean, she's going to bring it into the studio. I want to show it, because I was pretty impressed with the work you guys went to. Tell me, on average, what is a pack? Is there a specific pack for a specific person? There's one. I know there's one for a man. There's one for women. Tell me about how that works as she, I think, walks into the studio here. Yeah. Here we go. Check out this packaging, folks. So here it is. This would be the one. Do you know which one's for the men, which one's for the women, hon?
It says inside.
It says inside. Okay, so you open this, it says open here. So you open it up. And then and then there's one for the evening and one for the morning, right?
Yes.
Help me out, babe.
So these packs came from these packs came from literally 15 years of seeing patients from a functional medicine perspective. And to be honest with you, Brandon, when I first started seeing patients almost 30 years ago, I knew that most supplements had a lot of contaminations in them, were not effective. So efficacy was questionable. And on top of that, we don't really absorption. We don't know if they're going to be able to absorb it, break down those really hard pills and absorb the nutrients. We don't even know if there were what was promised in the pill was actually in the pill. And so I actually, for years, and there's so many studies that collaborate with this. So for years, I actually told my patients, don't take supplements because I didn't know what they were putting into their body. It wasn't until I became a functional medicine doctor and I had a chance to really understand and explore some of these companies that we work with now that help us make our supplements now in terms of over delivering and under promising. And the fact of the matter is, when I put my patients on supplements, my expectation is a certain result. And if I don't get it, it is not because these supplements aren't good. It's because there's something else going on. That's also why we have a 97% retention rate. 97% of my patients and people who buy supplements through myvitamin.com continue to purchase them
97%.
there because yes,
Wow.
they actually feel the difference. You actually feel the difference of how you feel. So we created these based on my years of doing actual lab testing and seeing that I would say about 98% of my patients were deficient in magnesium. And it's a no-brainer to go on a magnesium. Now, the type of magnesium you choose, you have to be really careful because the majority of magnesiums have undesired side effects of diarrhea. And so you really have to be careful. So this one does not do that. And it also helps you sleep and it also helps relax your muscles. So really, there's so much thought put into every single supplement. So basically, you're getting a functional medicine consult by ordering your med pack because, this is work that I've done based on actual data, not just my opinion. And so we put vitamin D in everyone's med pack because we know how critical vitamin D is. I mean, now we all know because just look at COVID patients, the patients who had the least amount of vitamin D fared the worst. Well, we know that vitamin D is critical for your immune system function. We know that this fish oil that we put in our supplement pack, we know that fish oil is super important for balancing out your omega-3 and omega-6 fatty acids, because if you have too much omega-6, which the majority of my patients had, then you are primed for inflammation rather than anti-inflammation. So a lot of people don't realize omega-3 oils churn down inflammation. So when I had patients who had COVID and who were in the middle of a cytokine storm and inflamed, I would put them on a very high dose of fish oil to churn the cytokines down. It dims them down. But so these are like little nuances you don't have to think about because I already thought about it all because I've been doing this for so long.
You've been doing this for over 25 years, right?
I've been a physician for almost 30, but I've been doing functional medicine specifically for about 15 years.
Wow.
So a long time ago, when I had my first miracle happen in my office, where I just simply had a patient quit eating gluten because of a book I randomly read, that was eye-opening because had she not done that, she would have, and she was only 22, her name was Sarah, she would have suffered for so many years. Because when you think about it, and so what we ended up doing, she came in with joint pain, had rheumatoid arthritis, and we sent her to a rheumatologist. She wasn't getting better. She came back to my office, Dr. Williams, what else can you do? I ran some non-typical blood work panels that were not typical of somebody coming in with joint pain. One of the panels we ran were celiac disease panels. and we diagnosed her with celiac disease. And once we took gluten out and started healing her gut, her joint pains went away. She was left on just a tiny bit of one medication. Prior to that, she had been on several that weren't working. And eventually I had left my practice because that was traditional medicine. And the corporate world was really upset that I was doing what I was doing, because after doing it so I never got to fully get her off medication, is what I'm trying to say. But because I only had to leave my practice because of,
So are you saying to me that you because you weren't using the prescription pad, that was...
I was doing weird. Yeah, I was doing weird things in my office, like doing stool studies. That was weird. Sorry.
You were doing stool studies.
I was doing stool studies and all these biomarkers that the medical board asked to meet with me. Sorry, give me 1 second.
Yeah, the medical board asked to meet with her. Wow. Look, this here is one of the pack. Now, this is the calming pack. This is what Melissa is now on. She just told me that. She said, Brent, I'm on the calming pack. I don't know what that means, the calming pack. I want to ask Dr. Williams what that means. But she has her morning. It says AM. It has a sunshine, the morning, right? Sunrise. And then she has the bedtime, the calm pack. So she has one in the morning and she has one at night, okay? And then this is the men's pack. Same thing. There's one for the morning and then there's one for the evening. And we'll ask her. Oh yeah, I can tell you right here. There's a multi for the men. There's a multi with iron. There's a D3, K2 D3. There's a mega oil. There's magnesium. How you say it? Magnesium chelate?
Yes, magnesium chelate.
Chelate. Well, see, I was trying to use phonics. It was CH, so I was trying my phonics, didn't work. Antioxidant blend. So this is the man's, and that was the one for the for the morning, probably, I guess, was it? But you have now Melissa's on the calming one. She just told me that. I had no idea she was on a calming one. No wonder she's been so chilled. No wonder she's been so chilled lately.
It really, we actually did a test on some of our patients checking their HRV, heart rate variability response, which indirectly measures stress response. We actually saw an improvement in HRV scores after just 1 month of using the Common Restore. That's how we knew with that one we kind of hit a home run. So for anyone who knows anyone who's wired and tired and busy and has a plate that's just overwhelming and full, this is a great supplement pack for them.
Okay, so there's the one for the men and there's one for the women. Now, this is the calming pack. This is the men's pack.
There's a foundational women. So the foundational one was based on just some foundational deficiencies that I consistently saw in people. And so that's what the foundational ones are. So everyone should be on a foundational. Now, the Common Restore has the foundational plus the calm, the things that help with calm, sleep, and adrenals, adrenals that are on the go, just calming everything down. Also, what a lot of our patients do is they'll take the foundationals, which includes a multivitamin, a really good fish oil, really good magnesium, and some K2 D3, all highly absorbed. All of our supplements are powder form, so literally their absorption rate and their efficacy rate at the cellular level is really, really good. Now, what you're also going to do for some people, for example, somebody who might have a genetic predisposition to dementia based on family history and also maybe ApoE testing, things like that we can also do. What we would recommend is adding the foundational plus the brain health. So if you look at the website, there are some people that are really worried about their immune system, especially during COVID. We sold a lot of the immune pack during COVID, and you add the foundational plus the immune. So you can get that in 2 different packs, and we're also going to be combining all of those packs as well.
Excellent. Now, tell me about, you mentioned something a while ago about people having tingling in their hands. So let's say you have someone that has gluten allergies, okay, but also has tingling in their hands, numbness, dizziness, these kind of things. And you go to the doctor and the doctor runs a blood sample and maybe says, we got to talk, we see some things. But what are they likely not checking for? The typical doctor's office.
They're not checking at gut health. They're not looking at nutrition. They're not looking and seeing that certain foods that you're eating, for example, in certain people, gluten can be a neurotoxin. So I literally will have people stop eating gluten who come in with restless leg syndrome without even checking any labs, because I've seen way too many times where gluten is the cause of the restless leg. And then we can start tapering off of the drugs that patient has been placed on by their primary care doctor slowly. But that's certainly something that's easy to do and certainly worth doing. When we talked about that, it was in the context of overall gut healing. So this is one of those things where if we can improve the immune system, insofar as decreasing leaky gut and improving nutrition. So it's kind of like taking out some bad and adding a whole bunch of good. Some of the good we're adding in are the supplements, but also we're looking at nutrition, we're looking at sleep, we're looking at diet, stress management, all sorts of things that we're doing in addition to, eliminating some of the things that might be harmful to your body. And they're so innocent, like gluten is an innocent thing, but yet in some people can cause really bad inflammation.
Is this because of the glyphosate in our bread and flour and everything?
It's because there's a protein called gluten that our bodies cannot fully process. And it is a leading cause of leaky gut. And if you have celiac disease, then your body's attacking it with antibodies. So we can actually check antibodies to gluten metabolites to actually look to see if your body's attacking your own cells because of what you're putting into it. So
why is this a new phenomenon, it seems like, in the last 10 years, 20 years?
Well, for one thing, we didn't understand. We didn't even know what a leaky gut was. When I was in medical school, I didn't even know that 70 to 80% of the immune system was on the other side of the lining of the gut. In fact, when I tell people, and I have a lot of patients who are doctors, when I
Wait a minute. You have a lot of patients who are doctors. So doctor.
And you know what? Yeah, and let me just tell you one more thing. One of the first set of doctors that started coming to my practice are oncologists. What does that tell you? And I was so happy that they were, because we know if we can shut down inflammation, we don't just shut down cancer, we shut down a whole bunch of things.
So when I hear surveys that I've heard now for a few years, like 90% of oncologists or some huge number of oncologists, if they got cancer, they wouldn't do chemo or radiation. Are you telling me some of them who are oncologists that I'm not doing that and they came to you?
That they came to me primarily for prevention, not treatment of a cancer, prevention of cancers and other things. And the reality is, whatever it is that you're seeing. So if your reality is that you're seeing a lot of cancer cases, you don't want that. So you're going to do whatever it takes to not get it. And that's our reality. It always, one thing that was always really, really gut wrenching to me is when I would walk into an oncology pediatric hospital and have to work with those children, because the outside world has no clue what's happening in the office of a pediatric oncologist.
Wow. So the oncologists are coming to you for prevention.
Primarily.
And what packet are you putting them on?
Well, so we do the whole thing. We do all the work. So these packets are sort of a foundation. So everyone gets these. Every single person gets the foundational pack. Now, sometimes we'll add a few extra things, or like, for example, if you came into me and we did genetic testing and you were high risk for dementia, then we're going to put a couple extra things in here to help prevent dementia. In addition, we'll help you curate a diet that's geared towards preventing dementia, for example. I did my own genetic testing recently, and I found that I personally am extremely high risk for diabetes. So I started really looking at what do I need to do to keep my blood sugars even all day long.
So how could I do that? Now you're in another state and I'm in Tennessee. How could I do this genetic testing?
Yeah, so as long as you have a home in Missouri, Florida or California, I can see you if you like. And also you can sign up through beingfunctional.com. You can sign up for a meet and greet and one of our staff members will call and help you out with that.
But you have to be in Missouri?
Florida. You have to have a home in Missouri, Florida, or California.
Okay. Now, if I don't, what do we do?
You have to find a local functional medicine doctor near you. And I will say that in functional medicine, when I started doing functional medicine, it was long before it became a big thing. So you want to find one with at least 5 or 6 years of experience because it does take a while to sort of get into the craft.
Okay, so you find one that's got 5+ years experience, and you say you want that genetic testing. So
yes.
Tell me what that involves. They take some blood and they do what? Why does your average internal medicine doctor you go to not do this?
Because I honestly think they wouldn't know what to do with the results. If you don't know, then you don't know, right? You can't do what you don't know. And it's not that your average internal medicine doctor isn't brilliant and smart, but you can't do what you don't know. And so for me, it was an additional 3 years of training. And then on top of that, I also mastered hormones. So that was a whole nother thing. So it literally has been continuous medical education for me for the past 15 years. When I finished medical school, it was just a matter of reading a few journals, staying up on top of continuing medical education. Super easy. Medicine doesn't change that swiftly. Functional medicine, if you're not staying on top of it, every 6 months, you're going to get outdated. So you really have to be constantly learning all these new things because we're growing. So for example, genetic testing, there was finally a company that I liked that actually tested your genes and also gave you a game plan. So it wasn't like 1,000 pages of here's your genetic testing and you have no idea what to do with it. We actually were able to categorize it into the genes that we are most familiar with into categories, for example, cognitive function or brain function, insulin resistance, and inflammation, things like that. So you can sort of target what you want to treat. But I digress. What I will tell you is this foundational pack, every single one of my patients gets this to start out with. And I will say probably about 50% of my patients, once we clean up their diet, we do this exercise program and all this kind of stuff, we don't need anything but the foundational pack for many of them. If you have something like a family history of dementia, I would highly recommend you get tested for something called an ApoE. You can do an ApoE blood test. Any doctor can do that. And then that's relatively well known in the community. Chris Hemsworth, the actor, he has an ApoE44, so he has an 80% increased risk of dementia. He found that out while he was doing the Disney show called Limitless. So watch that show, familiarize yourself with it, and then there's stuff you can do about it. You don't have to live in fear. Again, we educate and we empower. That empower and education over fear, and those are the gifts that we've been given. These are my gifts that I've been given from God, and I'm using them on this platform to hopefully open up some eyes and help people realize you don't have to be victim to all these things. I'm 55. When I went through menopause, I gained a lot of weight because now I know in retrospect, because I was genetically predisposed to insulin resistance. And it took me 3 years to lose that weight. But man, I'm not going to be overweight because I know overweight causes all these other problems. So it's in my control.
So if you have someone that's hitting menopause age, right?
Yeah.
Would you have a pack for that?
So that would be still the foundational for women. And if you're postmenopausal, we have a 50 plus for women who need a little extra smart calcium. Most of the calcium supplements out there are crappy. Do not take those, in my opinion. But the one that we have for 50 plus, that is the one that has a little extra smart calcium in it that has other minerals that your bone also needs to grow.
All right. So if you go to myvitamin.com/worldview, and please use that if you want us to get credit, because again, folks, we vet. How many months have we been talking to you, by the way?
Oh, several. I think we met almost a year ago at a conference.
Mm-hmm. And so now we're launching. Okay, you guys see how careful we are? We do our homework. Melissa does her homework. Melissa and her have talked quite a few times. Melissa and I and Dr. Williams have talked quite a few times. Melissa and her have texted multiple times. Melissa's gotten the packet. We really do our homework, right? Because we are not going to lose our credibility. We're not going to have our audience not trust us. We want our audience saying, if Brandon and Melissa are promoting this, that's because they did a lot of work and a lot of research and a lot of conversations, and they know this is legit. And that's also why you see us working with a lot of people that are also MDs, but have like functional medicine with it, because again, she's been enlightened to things that are not being taught in the medical school. So with that, go to myvitamin.com/worldview. Now, when you do that, folks, and you go to the shop, and you can see the women's daily, the men's daily, the women's daily 50 plus. Now the teens and the college daily, the immune health, the daily foundational plus immune, that's the one you keep talking about, right? The daily foundational that everybody should be doing.
Yes.
Okay. You keep going through, you got brain health, gut support, calm and restore. That's, I guess, one Melissa's on. Liver detox, weight support, hair, skin, and nails. Okay. Tell me, if you started out with the foundational, how does the person know, okay, after I got the foundational, now I need to do what? Add the men's daily to it? Tell me about that.
So if you're a man and you want just some good, really good foundational daily vitamins, all you need is the daily foundational for men. That's it. If you're a man who has a family history of dementia, I would highly recommend you get the men's daily foundational and add the brain pack to it.
Okay, so there you go. So you would grab the men's daily, and then you would come down here and you would add the brain health to it?
Yes.
That's if you had a family history of like dementia and Parkinson's and Alzheimer's.
Yes, yes.
Okay. Give me another example of a combo that someone, so everybody starts with the foundational pack, and then based on whatever they're dealing with, they go to additional. So let's say we have a woman dealing with, help me out. We said the word a while ago.
Well, another comment.
What, Logan? Yeah, menopause. Thank you. You say you have a woman dealing with menopause. So you start with the foundation pack, and then which one would you add to it?
Actually, for women dealing with menopause, my favorite one is actually the Common Restore, and we already added the foundational to that one. So we will have a choice you'll have a choice of just getting them combined or separate. So for the women going through menopause, the Common Restore, or already gone through menopause, the Common Restore is a really, really good one.
Now, where's that one?
That one is on the Common Restore right there.
The Common Restore is the one. Okay, so Melissa's grabbing that one. Okay.
Yes.
Okay,
Yep.
Calm and Restore. Okay, there you go.
Yep.
All right. Teens in college. Tell me about that.
One of the most common things we see in college are kids that all of a sudden leave home and they're eating crap all day, and then they're drinking a lot of beer for some reason. It's a very common pattern that we see. And what we also see is an incredible increase in stress, lack of sleep, and just all sorts of these bad lifestyle habits, right? And you can get away with it because you're a kid, but it does catch up to you, and it does affect your performance and your mental function. So a lot of our moms are like, hey, what can I give my kids? So we came up with this a multivitamin, especially for kids, vitamin D3, especially for kids, boosting up their immune system, but not too high of a dose. Magnesium to help them sleep and calm down at nighttime. So things like that. Now we also added we combined the immune and the foundational also, because a lot of our patients were combining those together, especially during the winter months when we saw a lot of viruses. So there's a foundational and immune pack combo that a lot of our patients take in the winter months, for example. And honestly, I just got off the phone with a marketing specialist who said, my husband and I were talking, we haven't been sick for a year and a half. Oh. And that coincided with when they started taking their supplements. We hear this all the time. That was just something I just happened to hear today. So that daily foundational plus immune, great thing to give your college kids. These college kids come home after finals week and they sleep for 3 days and they're sick. And there's reasons behind all that. But these supplements, in addition to really what we also found in a lot of our kiddos is when they started taking supplements, they also started paying a little extra attention to self-care, because doing one self-care thing we know has been shown to then add another and then another. So then you start stacking all these self-care things. And if you're going through the trouble of taking supplements, then maybe you start working out on a more regular basis, or maybe you start sleeping better because you're taking that magnesium that helps you sleep, things like that.
Wow. Now let's talk real quick before we wrap about, say, guys and prostate, right? Prostate. I don't know if you've read the book, Invasion of the Prostate Snatchers, and how you feel about that. But it seemed, I can tell by your facial expressions that you haven't read that one. Okay. But it seems like every time we turn around, someone's going in to have their prostate taken out. And I've read some up on this, and it seems like a lot of this is maybe, again, I'm not giving medical advice, I'm not a doctor, but my opinion is, it seems like I'm a little concerned. Like, just like they go to the pad real quick. Hey, well, here's a prescription. Yeah, let's get that prostate out. I'm like, obviously guys are concerned about that too. I think maybe women are too for the man in their life. So talk to me about things like that.
I had the same exact thought you did yesterday when I was talking to one of my men patients, and I was just thinking to myself, and in particular, he made the comment, when he eats more sugar, he has to get up at night more. And so that's one of his biggest motivators, to not eat a lot of sugar. Now, in his case, I also had the benefit of looking at his labs, and there's a form of testosterone metabolite that actually increases prostate size and this is the kind of stuff that functional medicine doctors learn, right? This is the type of stuff that we don't necessarily learn in medical school, and especially we don't learn how we can manipulate it earlier on. And I just thought to myself, wonder if I should put him on a supplement that will help divert some of the testosterone metabolites into one that does not cause the prostate to get bigger. So, and that's the problem, is benign prostatic hypertrophy, where the prostate gets huge, and then now you're waking up every hour or 2 hours to go pee as a guy. That's no fun. And plus it disrupts your sleep, which is a big pillar of health issue now, because now lack of good sleep causes all sorts of other things. But start early. And so this is what we counsel our patients on as well. But you're 100% right. It's almost like you're bound to get it if you live long enough, right? But you can take care of it, and you can help decrease your risk.
Is there anything in the current packs now, or are you going to have to develop a new pack for that?
There's nothing in the current packs right now, but that is something that we can maybe focus on, and we can create a one-time, like a bottle. I have a couple supplements that I really like that help with the prostate, and maybe we can have a prostate day, prostate 15-minute segment where we can talk about that, and men can buy just that one supplement. And it can be if they're worried about it, or if they're the ones getting up at night to go pee. And also, I would love to hear how the supplements are working for people when we have that opportunity.
Absolutely. We'll do that. We need an open phone line to take questions. And I keep saying in conclusion, but you keep bringing me to a point of I have to ask more questions. What about, I see all these, the shot nurse, go get the shot nurse, and the shot nurse is going to give you the flu vaccine, which no, and all this other stuff. But she's also going to give you your testosterone shot. And I know I don't do that. I know guys that run there and get their testosterone shot. They think that's going to cure all their problems, their weight gain, their being lethargic, and it's going to pump up their sex drive and all this other garbage. I'm like, sorry, I'm not doing that. But I guess there are problems for some people in that area. What is the men's pack going to help with that?
Men's pack. So these are just purely foundational. And when I say foundational, what I'm talking about is at the cellular level, what your cells need to work optimally, to make the most amount of mitochondria that you can make, to help with a little liver detox and things like that. Now, in terms of for example, the prostate or the testosterone, I'll tell you what, one of the biggest things you can do is not put your cell phone in your pocket. That's number one, because that's an EMF topic, but don't put your cell phone in your pocket. We'll leave it at that for right now. But the other thing is, we can actually, through the 5 pillars of health, through reducing stress, your testosterone is made out of cholesterol. Okay. And the cholesterol has to get into these cells, and actually into the mitochondria of the cell in order to start the processes of turning cholesterol into testosterone. So that we have so many different ways that we can affect testosterone production. So that's what we try to do, is we try to maximize that before we jump on a bandwagon of giving people testosterone. I don't have a problem with giving people testosterone, but not until we've maximized everything else, because all that other stuff will make the little bit that we give work better anyway.
And when you go to the store to buy your vitamins, you're basically buying junk at the store. Is that right?
What really impressed me were a couple things in my early medical practice. And number one is when I was looking at x-rays, and this happened 2 times, we actually saw undigested supplements in the stool, in the colon part, which is the stool, which once you get to the colon, you're not going to absorb a nutrient. And that was because the supplements were so hard. Like literally, you could literally bang your table on them. Ours are not like that. Ours are like in powder form. They're going to be very highly absorbed.
Oh yeah, I can see through the capsule and it's just a powder in there.
Yeah. Mm-hmm.
Yeah.
The second thing is there was a study done in New York by the Attorney General there, who looked at 5 different stores, and they took just supplements off the shelf, and only 20% of what was promised was actually in the supplements. The second thing is that there was a lot of other things. I'm talking plant parts and fillers and all this other. So I have no idea what my patients are getting. So like I said earlier, and this is very powerful to my patients and why they take these supplements. If this doesn't work, it's not because these aren't good. It's because there's something else we're missing. So I have to know that. Like, that's actual medical information for me, because if this didn't work, I have to do something else.
And, okay. So these are fresh, right? I mean, these are made, how fresh are these?
These are made the day you order them. That's how fresh they are. And they don't sit on a shelf. So they do have an expiration. You have to use your monthly pack within 2 months. Not because all of a sudden they go bad, but when you look at our ingredients, our raw ingredients, if you kept a pack for like 6 months, these will actually change in color.
Really?
Because they're raw and they're pure.
Well, that's a huge deal. All right. So we're going to be visiting with you more often. And I think I told you the other day that we have started a new channel this week. If you go to worldviewtube.com, worldviewtube.com, people will see it right there. We have a brand new channel, Home and Health. We're putting in some of Melissa's house-to-house programs. And then in a lot of interviews with people like Dr. Basima here, we are playing those in there. We're replaying those because these are just flat out educational and informative. And we have a huge library of great interviews like this. And we're going to be adding to it because you know what? You guys have asked for it. This is why our Bella Grace, our Numi, our Galatana, these things do so well, because there's science behind it. It's nutrition. It's getting to the cellular level. We've got MDs and functional medicine people behind it with us. This is huge. Our audience is gobbling up this kind of programming and asking for more. So clearly, and I don't know if it's just the age, me being 56 on the 26th of April. I don't know if it's the age group I'm now in. I don't know if it's the age of my audience, which my prime audience is generally women. 50 to 65 is my biggest demographic. Women, 50 to 65. Women love my programming, Logan, 50 to 65 years old. And so I don't know if it's that's because I'm a nice, sensitive, kind guy, Logan. I don't know if, I just mess with Logan. I don't know if it's the age and the demographic, but my audience loves this kind of programming. That's all I can tell you. And maybe it's post-COVID, who knows, right?
Well, and I'm grateful to have a platform to share some truths with you. So let's keep it going. Let's roll up our sleeves and really help empower everyone.
Absolutely.
And I'm very serious about that.
Absolutely. And we're going to be doing more of these visits. So thank you for that. Thank you.
My pleasure. Thank you so much.
Thank you, Dr. Williams, checking in, folks. And go there, okay? Go there to myvitamins.com. Use the code WORLDVIEW, if you would. Vitamin, don't put an S on it, Logan's telling you in my ear. Don't put an S on the end. My vitamin. My Vitamin. Don't put an S on that, folks. myvitamin.com/worldview. All right, folks, that's our broadcast for tonight. I hope you appreciate all we do here. I mean, where are you going to get programming like this? I have to ask that frequently. Where are you going to get it? This is a unique network, and you guys know it. And we are unique and different by design. Right, Dolly? Where'd you go, Dolly? You want to come say hi to everybody? Come say goodnight. Come say goodnight, Gracie. Come on up here. You haven't made an appearance the whole show. There you go. Yes, I love you too. Oh, yes. Have you've been with Cayman, I bet. She loves Cayman. She's smiling all day long. All right. We all are smiling with Cayman around, aren't we? We love having our granddaughter around. Hey, again, thanks for watching. We do need your support. Please go right now, will you? worldviewfoundation.com, worldviewfoundation.com. Go there right now. Support our work to keep it going, right? Till next time, and God save America. Take care.